Vaginal bleeding and vaginal discharge are both relatively common occurrences in most women and are often attributable to normal bodily function. For example, discharge is the body's method of ridding the vagina of harmful bacteria and dead cells from the vaginal wall. It is not a cause of concern if it's of normal appearance, should be clear or white, without odor. When that discharge changes, however, there is often a cause for concern. This is similar to vaginal bleeding. We see vaginal bleeding as a normal, healthy bodily function at menstruation, but when bleeding occurs outside of the normal cycle, some abnormal process is likely occurring. The female reproductive system can be quite fickle and responds to disruption quite easily. One of the key responses we see to disruption is vaginal discharge. Two of the most common causes of abnormal vaginal discharge are bacterial vaginosis and candida, otherwise known as a yeast infection. They are so common that testing is actually done on the same swab. Both BV and yeast will yield a thicker, malodorous, fishy-smelling discharge, maybe yellow or green tinged. A lesser found cause of abnormal vaginal discharge is Mycoplasma genitalium, which is a sexually transmitted infection infecting the cervical os. Mycoplasma genitalium, or MGen, has seen a recent decline over the last decade, but still impacts 1% to 2% of women globally, and if left untreated, can lead to certain infections like PID. It can also increase the incidence of ectopic pregnancy or fallopian tube malfunction. Moving on to vaginal bleeding, or abnormal uterine bleeding, there are so many causes and they are often hard to identify. We see vaginal bleeding often due to fibroids or polyps, which is one of the more identifiable causes. We also see it sometimes in ovulatory dysfunction, as is in the case of polycystic ovary syndrome or PCOS. Vaginal bleeding is also seen when there is a uterine disruption, such as endometriosis or adenomyosis, which is when the endometrium grows into the muscular wall of the uterus. Abnormal uterine bleeding also occurs in endometrial cancer or in vaginal atrophy as the body ages due to vascular changes in the vaginal wall, susceptibility to irritation, and tearing related to decreased cell turnover. When we often think of vaginal discharge, one of the first things that typically comes to mind are sexually transmitted diseases or infections. While these are absolutely accurate causes of vaginal discharge and some of the most prevalent, they are also one of the key causes for vaginal bleeding outside of the normal menstrual cycle, especially in your younger population, such as teenagers or young adult women. A key difference in STD-triggered vaginal bleeding and other triggers is the bleeding source. Most vaginal bleeding that we see independently from the vaginal discharge is uterine or from the endometrium. In these instances, however, the bleeding is often coming directly from the vaginal canal itself or from the cervix due to irritation from infection. Some key players that we see causing both vaginal bleeding and vaginal discharge are chlamydia, gonorrhea, or trichomoniasis, or trich. Generally speaking, most times that we see both vaginal discharge and vaginal bleeding coinciding are whenever infection of some sort or capacity is present. This encompasses the STDs that we discussed, but also pelvic inflammatory disease, endometritis, or atrophic vaginitis. While not all of these diagnoses immediately result in vaginal discharge or bleeding, and bleeding especially can be a sign of significant disease progression or irritation due to these pathogens. Some of these go unnoticed for months to years before symptoms do occur. So because of this, it is key that we encourage our regular preventative health maintenance and regular gynecologic exams. Thank you.